Okay, welcome to today's video. Today I'm talking about something very important because a lot of times I see patients coming to the clinic and saying, Doctor, I had typhoid and malaria. And the word typhoid and malaria is synonymous with our people who go about abusing antibiotics because they have access to antibiotics. Almost everybody that I've seen in my clinic always say, Doctor, I treated typhoid and malaria. In fact, this is the norm in the society, and it is high time we address this situation by looking at exactly what typhoid fever is and what it is not, because sometimes what people call typhoid might simply be malaria or nothing at all, because according to national guideline, nobody should take anti-malaria without confirmatory test, either the use of rapid kit test or rapid kits for diagnosis or microscopy. But our people keep on abusing antibiotics as well as anti-malaria, which we know the dangers. It might lead to severe consequence of resistance. So that is why I am coming up with this video today, and in today I am having a look at what typhoid fever is all about. So what is typhoid fever? Typhoid fever is a fever that is caused by a gram-negative salmonella enterica typhi. Okay, so this is the causative organism, and in terms of epidemiology worldwide, about 11 million to 21 million people every year has typhoid fever. Actually, it is not only fever. There are so many things in the clinical symptoms that we are going to look at, but the presenting symptoms exactly is what can be seen in other febrile illnesses like malaria. So we are going to have a look at how this infection presents with. So how do people get infected with typhoid fever? Typhoid fever is common in a place where there is poor hygiene, where the source of water is not clean, and the method of food preparation is not hygienic. People who drink water contaminated with fecal matter have this infection. Of course, people whose food are contaminated with fecal matter are equally infected. The people most likely hit by this infection are people with immunocompromise, the elderly and the young people, although people in other categories are equally affected. But it has been shown that people that have low gastric acidity have high risk of carrying this infection, because the acidity in the GIT helps fight the infection. So people with immunocompromise and the elderly that has low gastric acidity, and of course people that take some medications that decrease the acid acidity like antacid are going to have this infection more than the other group of people. So that means the quantity or the number of the organism the person ingests determines the extent of the infection or what might happen. So it needs a high dose of these infective organisms to enter into the system for somebody to have this infection. And of course, people can also have this infection via fecal oral means. That is, if the hands that is soiled with fecal matter goes into the mouth, somebody can have the infection. Of course, there's also been shown that during sexual intercourse, people can have this infection. Apart from this, flies can also carry the fecal matter and drop them on the food, and people become infected. In addition to this, it has also been shown that hospital staff, workers who are not very careful at the time that they are folding the linens, bed linens, can get this infection from the people who are chronic carriers. So these are the possible ways through which this organism can get into the body. So when somebody ingests this organism, the organism gets into the blood and through the lymphatics spreads and causes infection in the body. So let's have a look at the incubation period, which is a time from the time or a period of time from when the infective organism enters the body to the manifestation of the first clinical symptoms. The incubation period is usually 10 to 14 days. So after somebody had the infection into the body, with this time frame of 10 to 14 days, there will be clinical manifestation of the symptoms. One of the symptoms that somebody will come down with is fever. Okay, so fever, other symptoms will include pharyngitis, which is inflammation of the pharynx. Apart from pharyngitis, somebody may also have anorexia, which is a feeling as if somebody wants, a feeling of not having appetite for food, no desire to eat food. Apart from that, some people may also have abdominal pains and abdominal tenderness. Okay, then there are also non-regular symptoms like painful urination and non-productive cough can also be the symptoms. Alright, so how does it go after all these things have happened, and how can we differentiate the fever that is caused by malaria from other ones? If somebody is having malaria, they come down with fever, and if somebody is having typhoid fever, they also come down with fever. So how do we differentiate the two? How do we know this is typhoid fever? So like I said, the fever of typhoid fever presents, it comes in a stepwise manner. Between 2 to 3 days that the fever starts, it will now keep on increasing, okay, and then it reaches a plateau at 10 to 14 days, and then by the third week it comes down gradually, and by the fourth week the temperature becomes normal. So that is how the fever in typhoid fever presents, in a stepwise manner over 2 to 3 days, and then reaches the height, remains elevated at 10 to 14 days. The temperature reaches 39.4 to 40 degrees Celsius. Right, so by the third week it begins to fall gradually, and then by the fourth week the temperature returns to normal. All these things would be seen when nothing has been done, no intervention has been given. Then let's in the disease, if nothing is also done, then the person can come down with a florid diarrhea. The diarrhea contains blood, and this blood can be what can be seen or what cannot be seen. In other words, the blood in stool can either be occult or gross. In 20% of the cases, the blood in stool would be occult, not seen, whereas in 10% of the cases, the blood in stool would be seen. And also in this situation, some people may have very severe abdominal pain. So if there is abdominal pains and what is called rest level of white blood cells, leukocytosis, this might signal perforation of the guts, and this perforation of the guts take place at the distal ileum, that is part of the small intestine that is called ileum, and that would be in about 1 to 10% of cases. The patient may have a gut perforation. All right. Also, in the course of this illness, if nothing is done, other complications may set in, such as bacteremia, that is infection of the blood that may lead to occasional focal infections such as osteomyelitis can occur. Endocarditis simply means infection of the heart valves, whereas osteomyelitis, bone infection, may also occur. And meningitis, which is inflammation of the meninges, that's the covering of the brain. And of course, glomerulitis, inflammation of the glomerulus, which is part of the kidney. And of course, abscess formation. There could also be abscess, like soft tissue abscesses may also take place. This and other things may happen if nothing is done about the patient. And of course, some people may have central nervous system complications, like becoming comatose. They may go into a state of coma, not being aware of what is going on. They may also have, they may also become stuporous, that become confused, and apart from this, some may become prostrated, being very weak to either sit or walk by themselves. So why am I particular about this typhoid fever? It's because a lot of times I see people coming to say, "Doctor, I treated typhoid." No, they will say, "Doctor, I took typhoid and malaria." "Doctor, I took typhoid and malaria." So I will say, "What do you mean?" "I went to the lab and the doctor said," that is the doctor in the lab. Of course, there's no doctor in the lab. "The doctor said I had typhoid and malaria, and I treated the typhoid and malaria." The question I also ask is, what is the source of your water and how is your food prepared? Because these are the means through which people can have the organism enter into their body, from there into their bloodstream. Well, I understand quite well that in our environment we have challenges. The source of water is a problem, and even the food vendors. Some people eat from outside, and even where our toilets are located, in most places there are nothing to write home about. So I will not be surprised that these people may have typhoid fever, but it might not really be the titer or what the so-called doctors diagnose. I mean, doctors in the lab, not really doctors per se, but what these people diagnose may truly not be, because most times the people that I see that complain that they had typhoid, you see these people that are walking about normally, communicating. Some of them don't even have fever at all, let alone have the features that we have mentioned. So sometimes it's a mere ignorance on the part of the people and the inability of the authorities that appear to control how people buy drugs, because the reason why people abuse these drugs is because they have access. Anybody can go to anywhere, can even go to the open market. I think it is only now that I don't see drugs being sold in the open market. You see drugs being sold like pepe and crayfish, and people can just go and pick them on the floor or on the ground. That was the practice then, but I don't know what is happening now. It's like government has step up effort to make sure these things, but then people are still doing it. Otherwise, you will not see people coming down to say, doctor, I took typhoid and malaria. All right, so let's move into what the diagnosis would be like. If you are a doctor and you are suspecting that your patient might have typhoid fever, as a doctor you know what to look for. You know that in your history you have to elicit, most importantly, the source of water, the food hygiene of the patient. Is the patient a health worker? Okay, and other things that may expose the person to having typhoid fever. Alright, so you ask questions and you come up with your impression on what to do about the case. Most importantly, sometimes the people that go to the lab to do tests, they use what is called the Widal test. And the Widal test that they do is not the one that's supposed to be done at all, because the recommended test, this Widal test, which is only about 70% specific. 70%, is it 70? I think sensitivity is about 70%, but the specificity is doubtful, because there are other non-typhoidal species that can give the same reaction, and also some infections like cholecystitis can also give a positive reaction. So the specificity is doubtful, but the sensitivity of the Widal test is about 70%. But apart from this, I think the problem with the Widal test in some of the places that people do is the use of the blood, and on one occasion somebody will say, oh, it's typhoid or it's typhoid fever, but the correct thing to do is to collect the sample, okay, a pair of sample that is checked, okay, and if there is a fourfold rise in the titer, that is fourfold rise, you collect it now. In the next 2 weeks you collect again. If you see a fourfold rise in that titer, you can now say, okay, this person has um, typhoid fever. That's how it is. But many people that do it, they only collect the blood and rock it and say, oh, no. That is why it is that method of diagnosis or laboratory diagnosis is not recommended. The one that's recommended, however, is the culture. By the first to second week, the blood sample would be useful to isolate the organism, and the culture of that sample will give you the result. Then, by the third to the fourth week, the stool culture, the stool will be the usual sample to be used. But in many of the places that this thing is done using a rapid diagnostic kit, everybody uses blood, and they may not even consider the timing. Is this presentation in the first week or second week or the third week or the fourth week? Everybody goes straight to using blood sample. That might not give the accurate result, apart from the fact that the specificity of this test kits is not reliable. The sensitivity is only 70%. So that is how typhoid fever presents. I said earlier on that the disease burden is about 11 to 21 million worldwide. Okay, 11 to 21 million people come down with this disease, and the complication can lead to perforation of the guts, gut perforation, septicemia, okay, even pneumonia can also be a complication of this. The pneumonia that may occur as a result of typhoid fever may be secondary infection, although salmonella typhi itself can also cause pneumonia. Some people may also have clotting abnormalities. Okay, that's consumption coagulopathy. It means the factors that allow blood to clot if there is a bleeding, those factors can be used up such that clotting of blood might become a problem. So typhoid fever is a serious medical condition that should be treated promptly. So let's look at the prognosis. And what is prognosis? Prognosis means what could happen if somebody has this typhoid fever and nothing is done. If somebody has typhoid fever and nothing is done, the case fatality is 12%. Or if something is even done late, the case fatality, that means the total number of people that would die if they have this disease, this condition, when they are not treated. If there are 100 people that have this disease, 12 people will die when treatment is not given, or treatment is not given promptly. However, if there is prompt intervention, prompt treatment, only 1% of the people infected may die of this disease. It is instructive to know that people that have coma, stupor, and prostration may further be at risk, in this case, fatality. Like I've said in all my videos, I will not go into treatment. The treatment would be the sole responsibility of the clinician that the patient present him or herself to. But let's have a look at what we can do in order not to have this infection. There are some vaccines that are given, though not in the developing countries such as ours. Maybe there are, but I'm not aware of any. But in the developed countries, there are vaccines that are being given. Maybe our own country would soon come up with the vaccines, or maybe they are giving it, but I am not aware, to be very honest. So vaccination is one of the things. But apart from this, good hygiene should be emphasized. The use of water, and that's running water and soap, to clean the hands before using the toilet and after using the toilet will help prevent fecal-oral transmission. And of course, the young children may not know how to take care of themselves very well by washing their hands. The parents have the responsibility to ensure that their children are properly educated, and also help them in proper hand washing with clean water and soap. And of course, the toilet system is important. Open defecation should be discouraged. People should have good disposing system. If you don't have water closet and you have a latrine, a pit toilet, the toilet should have a covering, something to cover, so that flies would not be running from the latrine and be sitting on somebody's food. Restaurants should be well regulated. Food vendors should see it as a matter of responsibility to make sure any environment where food is sold is kept clean. Flies should not be seen at such places. The food vendor should be hygienic at all times. The place where food is prepared, the kitchen, should be properly inspected by food inspectorates, people that are in charge of food regulation. Because sometimes you go to a place called restaurant and you look into the backyard, it's filled with flies. And even right in the restaurant, you see flies perching on people's food. All these practices can make people come down with typhoid fever. Okay? So proper hand washing is the key. And then, of course, vaccination against salmonella, enterica, typhi. And what else? Next thing would be proper treatment by qualified medical practitioners. So if you have fever that comes in a step-like fashion, okay, over 2 to 3 days, keep on increasing 2 to 3 days, and then goes to a plateau, remain high for 10 to 14 days, okay, reaches like 39.4 to 40 degrees Celsius, and then the fever gradually comes down by the 3rd week, and then it returns, your body temperature returns to normal by the 4th week. That may be typhoid fever. Okay, so learn to recognize the clinical symptoms as an individual, and then do what? Go to the hospital where the doctor will get information from you, carry out examination, do some investigations, and then treat you with the appropriate antibiotics. If there is gut perforation, the doctor will know what to do for you. Please do not be indulged in what? In self-medication, and stop abusing antibiotics saying, doctor, I took typhoid and malaria. The national guidelines prohibits the use of anti-malaria without confirmatory test. This is to ensure that resistance to the only anti-malaria that we are using now does not develop. Alright, so I believe with this video you have learned something about typhoid fever, what causes the typhoid fever, how it is transmitted, what the clinical symptoms are, the complications that might arise, and what could be done to prevent the infection, and of course the wrong diagnosis and the wrong assumption made by so many people. So please, I hope you've learned something today. Could you please like this video and follow my series of videos? Drop your comments in the comment box, please. I ask you to follow my page so that next time when I'm doing videos, you may be one of those to be notified. And of course, share this information. Let others also learn and benefit from what my little effort here is. Please stay safe and stay free from typhoid fever. And mind you, there's nothing like, doctor, I took typhoid and malaria. Always go to qualified medical doctors for your proper diagnosis and treatment, in order not to abuse drugs and have the dangers of drug abuse. Thank you very much. Till I come your way next time.